So before I walked into the room, I would verify the order with the physician and then gather my supplies. I would knock, provide patient privacy, hand hygiene. Hi, my name is Ashley. I'm going to be your nurse today. Can I get you to verify your name and, this shouldn't be on there yet, but can I get you to verify your name and date of birth for me? Check that with the MAR, make sure she's the right patient. So today I'm just going to be cleaning out your trach. Is that okay? I'm going to clean your inner cannula and then around this site. Okay. Alright. Then I would apply clean gloves. Go ahead and apply the pull socks, which I will leave on throughout the whole procedure. I will go ahead and auscultate the lungs. Okay, and then at this point I would hyperoxygenate the patient as long as it was in the orders. And then I would get discard of my clean gloves and move to the sterile field. So I would open this up, and then before putting sterile gloves on, I would pour the saline in without breaking sterile field, so around. And pour that in there. And then at this point I would become sterile, so apply my gloves. And now that I'm sterile, I can go ahead and take this out of the field. I could put this on the patient if I'd like, or not, just discard of it. And then make sure that my brush is easy access. So at this point, I would choose which hand would become clean and no longer sterile. So I would use this hand to remove the oxygen, and then take out the inner cannula. Go ahead and drop this into my saline solution, and then reapply the oxygen with the same hand. And then I would go ahead and, I wouldn't put this in their life, but I would go ahead and grab that same part with the same hand, and I would take this brush, go ahead and clean the outside, and then clean the inside, mixing it or rinsing it off each time. And then I would dispose of this after I was done. And then go ahead and now make this hand clean and pour in the saline solution. I would go ahead and, at this point we're both clean so I can use both hands. So I would remove the oxygen and go ahead and replace the inner cannula. And then re-oxygenate, make sure the patient was feeling okay, ask how she was doing, how she tolerated that. And then I would begin cleaning the stoma. So at this point I'm clean, I'm no longer sterile. So I would remove the oxygen. Go ahead and remove that outer dressing. And then dispose of that. I could go ahead and unhook this oxygen so it's not in my way. Okay, and then I would take the Q-tips in the kit and dip them in saline. I could put the saline in this new side so that it's not using the same dirty one. Go ahead and do that. I would clean from the inside to the outside, using a new Q-tip every time I need to clean the site. Just go ahead and getting in there. And then oops, I would not put that back in there. And then I would go ahead and reapply a new dressing. So I would make sure to hold on to this so that it wouldn't come out, and then go ahead and put this in here. Since I am working alone, I would leave that on so that it didn't come off until I was ready to change it to the next one. And then I would go ahead and place this behind the patient's neck. I don't know if we're supposed to do it or verbalize it. Okay, so I put this behind the patient's neck and then change out each one at a time while still having a hand on here so that it doesn't come out. And then after I was finished, I would reattach the oxygen, and then I would unhyperoxygenate the patient, ask how she was doing. I would go ahead and remove my gloves at this point, go ahead and perform hand hygiene, and then I would make sure to be monitoring the pulse ox the whole time, but then I would go ahead and re-auscultate. So, okay, then I can go ahead and remove the pulse ox. Make sure that the patient had her call light in reach. I would go ahead and lower the bed, make sure that there was the right amount of side rails up, ask if the patient needed anything, and then I would document.